Hey everyone! Today, we're going to break down something that affects millions of people all over the world, diabetes. But to really truly understand it, we've got to start with a question that applies to every single one of us.
Have you ever really stopped to think about it? How does that apple you ate or the toast you had for breakfast actually become the energy that's letting you think and move right now? It's a pretty amazing process, and getting a handle on it is step one to understanding diabetes.
So at its core, diabetes is what happens when that whole energy-making system goes wrong. The body just can't manage its blood sugar or glucose anymore, and that leads to way too much glucose hanging around in the blood, which is where all the trouble starts.
All right, so before we dive into what breaks, let's take a quick look at how this whole system is supposed to work. When everything's running right, it's like a perfectly coordinated factory inside your body.
It really boils down to 4 simple steps. First, you eat carbs, and your body breaks them down into glucose. Second, that glucose gets into your bloodstream. Third, your pancreas senses the glucose and releases a hormone called insulin. And finally, step 4, insulin acts like a messenger, telling your cells to open up and let that glucose in for fuel. When it works, it's beautiful, simple, and super efficient.
You know, probably the best way to think about this is with a simple analogy. Just picture your body's cells as little locked houses that need energy. The glucose is the fuel delivery, waiting right on the doorstep. But it can't get inside without a key. Well, insulin? Insulin is that key. Without it, all that great energy is stuck outside, completely useless.
And that right there brings us to the heart of the problem with diabetes. What happens when you don't have enough keys? Or what if the locks on the doors are just busted? Well, that's exactly when the system starts to break down.
This visual really helps lay it all out for us. Let's start with the diagram at the top, the one labeled healthy. See how the pancreas makes insulin? That's our key, and it fits perfectly into the cell's receptor, the lock, which lets the glucose flood in. That's our baseline, our North Star for how things should be. Now let's see what happens in type 1 and type 2.
Okay, so let's break down the 2 main types. On the left, we have type 1. This is where the body's own immune system gets confused and actually attacks and destroys the cells in the pancreas that make insulin. The factory that makes the keys has effectively been shut down, you just don't have enough keys. Now over on the right, we have type 2. This is different. Here, the pancreas is usually working overtime, making plenty of keys, but the locks on the cells have become rusty or faulty. They don't respond to the key anymore. That's what we call insulin resistance. But in both cases, the result is exactly the same. Glucose can't get into the cells, so it just builds up and up in the bloodstream.
Now, type 1 and 2 are the big ones we always hear about, but they're not the whole story. There's also something called gestational diabetes, which can pop up during pregnancy, and you can even have drug-induced diabetes from certain medical treatments. It really just goes to show you how delicate and sensitive this whole energy balancing system is.
So that naturally leads to the next big question, right? How do you know what your personal risk is? And what are the early signs you should be looking out for? Let's get into it.
Risk factors usually get split into 2 buckets, the stuff you can't change and the stuff you can. So in that non-modifiable column, you've got things like your age, your genetics, your family history, stuff you're born with. But the modifiable column, that's where you have some real power. This is your diet, how much you move your body, smoking, blood pressure. These are all areas where your choices can make a massive difference.
So what does it actually feel like? Well, when you have all that extra glucose in your blood, your body tries to flush it out. That's why common signs are being incredibly thirsty and having to urinate a lot. And because your cells are literally being starved of energy, you might feel exhausted all the time, or even start losing weight without trying. These aren't just minor things. They're huge red flags from your body telling you something's wrong with its energy system.
And paying attention to those signals is so critical, because unmanaged diabetes isn't a short-term problem. Over many years, high blood sugar can silently cause a ton of damage throughout your whole body. So let's talk about the long-term stakes.
Let's start with your heart. Think of high blood sugar as being sort of abrasive as it flows through your blood vessels. Over time, it damages the delicate lining of your arteries, making them stiff and a perfect place for plaque to build up. This narrows the pipeline for blood flow and dramatically increases the risk of heart attacks and strokes.
High blood sugar is also really toxic to your nerves. It can wear away their protective coating, especially those really long nerves that run all the way down to your hands and feet. This is called neuropathy. It might start as just a little tingling or numbness, but it can progress to serious pain or even a total loss of feeling, which can lead to other problems like sores that just won't heal.
Your kidneys also take a huge hit. They're the body's filtration plant, right? They're forced to work overtime,
trying to filter all that extra sugar out of your blood. This constant pressure just wears down their tiny filtering units over time. This can lead to chronic kidney disease and, in the most severe cases, the need for dialysis or even a kidney transplant.
And finally, your eyesight. The tiny, tiny blood vessels in the back of your eye, in the retina, are incredibly fragile. High blood sugar damages them, causing them to leak or weaken. This condition, called retinopathy, can cause blurry vision, cataracts, and if it's not managed, can lead to complete blindness. It's actually one of the top causes of blindness in adults today.
I know we've covered a lot here, from how your body makes energy all the way to some really serious long-term complications. But the goal here isn't to feel overwhelmed or scared, it's to feel empowered. It's not about making a massive lifestyle change overnight. It's about understanding the power of small, sustainable steps. So the question I want to leave you with is this. Knowing what you know now, what's just one small change you can make for your health